unfortunately, children who are not breastfed are given.
Do they oxidize easily then if they were put in formula? Why haven't they put those in formulas for kids?
Well, there's a lot of controversy of why that's not being done right now, and of course there is more of a public outcry where I think you will actually see that in there. Certainly fish oil supplements are out there in liquid form, and certainly adding a little bit of vitamin E has a protective effect from those oxidizing. So I don't necessarily buy that that's the main reason why.
Yeah, we won't go there tongue-in-cheek. Okay, yeah, I mean, there's always the powers that be. What about managing the side effects from chemo and radiation? Are there foods that can help with this?
Sure. In fact, many patients make a decision of whether they're going to go ahead and elect for what we call conventional therapy, such as chemotherapy and radiation. And with chemotherapy and radiation, unfortunately, the benefit is certainly good at killing the cancer cells, but unfortunately they can affect healthy cells as well, too. Right. So the key is with our program that we advocate is that we try to reduce the negative effect on healthy tissue. And also side effects quite often can be mouth sores, nausea, vomiting, diarrhea, constipation, and all points in between. So we find that actually following the diet that I was just emphasizing, focusing in on lots of fresh fruits and vegetables, whole grains, more plant proteins versus animal proteins.
It's a live food diet.
It is.
Right.
And I always feel, and again, if you want to look at it from a spiritual standpoint, I think God knew what he was doing when he put all these foods on the plate.
Sure, he did. He did.
And of course, we like to muddy it up a little.
Yeah. Let's make that taste like fruit. You know, it's not fruit at all. Okay, so that's what they need to do. Are there supplements that you recommend?
Well, Deborah, there definitely are a lot of vitamin supplements that are very beneficial for patients who are undergoing conventional therapies. However, I usually strongly encourage our patients not to do it on their own. They should seek out the advice of a professional nutritionist because unfortunately some things can go awry if you are using vitamin supplements during chemotherapy and radiation. For example, some of these therapies can actually cause a thinning effect on the blood. And in essence, a thinning effect on the blood probably would be beneficial for a lot of us here, but when you are starting to take supplements like ginger, omega-3 fatty acids, vitamin E, coenzyme Q10, there's a variety of ones that can actually cause more thinning of the blood and potential hemorrhaging. So again, that's one area of caution that I recommend. And also, again, there are some supplements that are very beneficial in helping to offset some of the side effects from some of the chemotherapeutic agents, like an agent called adriamycin, which can cause a what's called congestive heart failure, or a less of a squeezing action of the heart. And they found now that coenzyme Q10 may actually help strengthen the squeezing action of the heart.
That's wonderful. So you have to stay right on top of all these studies here, because this is a lot of information. I'm sure new investigative studies are being created all the time.
Yes, all the time.
Right.
Which is good, and we're finding that actually the government is now getting involved in actually sponsoring some clinical trials.
It's about time. That's good.
Well, the public has spoken.
Yeah, the public demands it. That's great. Tell me this, does your basic diet vary from individual to individual?
That's a great question, because I hate to say that we offer a cookie-cutter program for everyone. However, the basic tenets of the program tend to be very similar. And that's why I feel very comfortable in saying that when we have a patient that has to follow a therapeutic diet, I as a nutritionist would feel very funny recommending something that was also beneficial for the rest of the family. However, we may recommend, let's say for example, if we have a breast cancer patient that is not an estrogen-driven type of cancer, we may find that soy may be very beneficial for that person.
How would you know that?
Well, there is some research that is suggesting that there is some controversy about estrogen-driven cancers in soy, and sometimes it gets a little bit more complicated than that, whether they're pre- or post-menopausal. But we have more sophisticated analysis of how we determine what is appropriate for each patient. At the center where I work, we actually do specific blood testing now to look at plasma levels of antioxidants, and also looking at what kind of oxidative stress is occurring and how much damage is being occurred. And we can actually make a very specific supplement program based on that information now.
Is this a urine test?
Well, actually, it's a blood test.
It is.
And
Is it Spectris? Who do you use?
there's a company called AAL, and they
Okay.
do this oxidative stress.
Yes, yes, yes.
And they also do something called an immune function test, because it's also important to have to make sure that you've got the right amount of soldiers on the field to fight the
Right.
battle.
Now, do you use the whole live blood cell analysis at all, the one you look at underneath the slide, underneath the microscope?
Yes, very familiar with that. However, we don't use that as part of our diagnostic tools.
Okay.
However, there may be applications for that.
That are
However,
useful, yeah, that make them worthy and applicable.
Right.
So once you put people, after you do the analysis and you put people on the protocol, do they see good results generally? Do they feel better as
Well,
they're going through their treatments?
That's actually another great question, too, because sometimes what's happening in a cellular level may not be experienced at first at a
Right.
greater level.
Right.
So we usually ask people to be somewhat patient, but one of the things that's very interesting is many of the chemotherapeutic agents that cause immediate side effects, we're seeing a lot less occurrence of those side effects and
That's
also a
great.
diminished intensity of those side effects. And we attribute it greatly not only to the nutrition, but all those other interventions that we suggested as well.
That's wonderful.
Quite often at our center we have patients that will be actually getting an intravenous chemotherapy, but we actually have them bouncing on a rebounder or having a Qigong class or getting massage therapy,
That's
creative
wonderful.
writing. And if you think about it, most people that you've ever seen getting these sort of conventional therapies, they're sitting in a lazy boy watching TV. Well, no
Yeah.
harm in doing that, obviously. But obviously we want to have something with a little bit more stimulation.
So you actually have them doing their chemo and they're bouncing on a rebounder?
Sure. And
That's
they may
so
even
cool.
be watching my cooking class while they're doing that.
And you do cooking classes too?
We do cooking classes
That's
too.
marvelous.
Well, I think what's scary for a lot of people, if you think about it, you're going through those type of therapies, and the one thing you have to look forward to is eating something you enjoy.
food, sure.
Well, I'm kind of the guy that takes that all away for a lot of patients. And
Sure.
sometimes I'm the bad guy, but so it's my duty to make sure I can show them that these foods that are healthy for you can
Are
actually
delicious.
taste good and
Sure.
enjoyable.
Well, people are very nervous. Most people, most of the time, think healthy foods taste like duty.
Right.
You know, it's like
right.
if it's healthy, it's like tofu.
Right.
You know, that kind of idea. That's great. I didn't know you offered all that.
Oh, sure.
That's
sure.
wonderful.
And that's the good news. I always tell my patients my Achilles heel is probably sugar or sweet tasting things. And we now know that there is a sugar cancer connection. And so we try to advise our patients not to focus in on sugars or foods that will rapidly turn into sugar. But there's a lot of great natural sweeteners that are out there that actually give the taste and sensation of sugar.
So this is interesting because Americans typically consume their own body weight or more in sugar every single year. And I happen to be allergic to sugar. I was raised on Carol syrup and water.
Oh, wow.
And I couldn't take breast milk or formula, so that's what they gave me because I was so skinny. But consequently, I'm allergic to sugar, and I know whenever I have sugar, my nose fills up with lots of mucus, so it's like an allergic reaction. But that's interesting. So people are consuming more sugar than ever before, especially kids.
Yeah, and unfortunately that number isn't going down, Deborah, it's going up. And if you think about it, it's in everything, practically everything that we eat. So it's very important that the consumer be a label reader out there, as cliche
Sure.
as that sounds. You really have to look for
Hidden
the
sugars.
hidden sugars and the different names that they use for sugar.
Right. And if you need lists of different sugars that are hidden, you know, names that you might not be familiar with, call, and we'll be happy to fax it or mail it to you. We're running out of time here, so we've got to kind of scoot along. What about patients in remission? Is there an ideal program? And do you kind of lighten up on your recommendations during the maintenance phase?
That's a great question, too, because I think a lot of people, after they've gone through this onslaught of either surgery and, again, all these conventional therapies, and then they're on the stringent diet, the natural reflex is to say, give me a break. Let me take a breath of fresh air and let me go ahead and go back to what's comfortable for me.
What, like hot fudge sundaes?
Well, exactly, and that's a natural instinct that
And
we
you
have
let
to
them?
do that. Well, we don't.
You let
In
them?
fact, I always tell people I've got a size 13 shoe and I know how to use it. So.
Well, I mean, if they've gone through all of that and they've been supporting their body, aren't they always at greater risk after having had cancer to develop, you know, cancer again or to have a more sensitive immune system?
Well, the sad reality, Deborah, is that many of these cancers can actually recur. And, but there's some things that they can do about it. And if you think about it, once you stop chemotherapy and radiation, now it's totally up to your body to fight the battle of
Right,
cancer.
right.
So to me, it makes more sense to be even more vigilant about staying on your dietary
Sure.
and wellness program.
Okay, well that makes good sense. What do you feel about taking supplements during conventional therapies? Do you think it's safe?
There's a lot of controversy about that, and that's another great question. There's a lot of research that's being done about that without getting into super great detail of why we feel it is important to take antioxidants and so forth. We feel strongly that nutrition is vital and an integral part, and to try to achieve that solely through food is often difficult for the
Sure.
patient. But we also find that a lot of our nutritional supplements we recommend are actually biological modifiers. They can actually change that terrain that cancer cells grow in. And there's a lot of great research that's really coming out about that. Unfortunately, Deborah, we have many people who come to our center that their oncologist said, well, you know what, it's important that you don't lose weight. Eat whatever you want to. Go to Burger King, McDonald's, drink lots of shakes. And unfortunately, that advice, I think, is irresponsible because the type of those foods that are in there contain ingredients that could be conducive to cancer cell growth.
Sure. So if we could retract for a moment, you mentioned there were sugars that are cancers that are associated with sugars, too much sugar. What would they be?
Well, for example, there's a diagnostic test called a PET scan.
Okay.
And what they use is something called a radioisotope of glucose, which they inject into the bloodstream. And this diagnostic tool picks that up, and it sees the cells that are more rapidly metabolizing this glucose or eating the glucose. And those cells happen to be cancer cells. They have a ravenous appetite for sugar.
Really?
So we encourage our patients to avoid foods that turn to sugar more rapidly.
So is that a preventive screening that you offer?
Well, it's not a preventive screening, the PET scan. Actually, it's a diagnostic tool to detect whether there is undetectable cancers that are hard to find.
Got it.
But however, we think it is a very good idea to ease into a diet that really is very low in sugar. Because we certainly know that sugar, not only is it associated with tooth decay, but certainly obesity. We have seen some studies showing that a 75-gram load of sugar can suppress the immune system for over 8 hours.
Yep. It's amazing, isn't it?
It's scary.
So,
and it's very pervasive in our diet.
Yeah. So I think it's a can of soda lowers it for 5. Right?
There you go.
About that?
That's right. That's
Amazing.
Exactly.
What about detoxification? Should patients detox when they're going through chemo or radiation?
Well, I really think it is a great idea to do that, but not to do it unassisted.
Okay.
We don't feel very comfortable for patients who come to our center and talk about doing a detoxification program if they're not under our care, because I really think you should be under medical supervision if you're being detoxed. The reason is, or rationale is, that during this detoxification process, you may actually be decreasing the effectiveness of chemotherapy and radiation if it's done at the wrong time. And so that's why I think it has to be very closely monitored that you're doing it appropriately, because if chemotherapy or detoxification is used appropriately, it may indeed sensitize those cells to have a greater killing effect on the cancer.
Okay. David, we could talk forever. Don't go away, because next week we have David coming back again, and we're going to be talking about more very important information regarding cancer and healing and taking care of yourself so you don't end up in the cancer boat. So until next week, take good care of your health. And David, thank you for being here. This was wonderful.
Deborah, thank you.
You're just a wealth of information.
Oh, I appreciate being here.
Good night, everybody.